Hi, Dr. Sharmeen. Am I audible?
Hello.
Hi, Dr. Sharmeen. Good evening. Am I audible?
Yes, sir. Now you are audible. Thank you so much for being here, sir. So we are very
Just
much
give me one
excited to
minute.
have you.
You're not audible to me.
Okay, sir.
Yeah, hi, Dr. Sharmeen. Am I
Sir, now I
audible?
am audible. Yes, sir. You are
Yes.
audible.
Okay. Yes, I'm able to hear you.
So thank you for being here, sir. Sir, we are very much excited to have you.
It's my pleasure. Thank you so much for inviting me.
थैंक यू सर सर हमने बहुत सारे स्टूडेंट से कांटेक्ट किया उनके डाउट पूछे उनसे क्वेश्चंस पूछे तो बहुत सारे स्टूडेंट्स के सेम डाउट होते हैं तो सर हम चाहते हैं कि आप हमें गाइड करें हेल्प करें उस डाउट को क्लियर करें
Sure. बिल्कुल.
तो सर फर्स्ट डाउट था हाउ कैन वी रिवाइज 19 सब्जेक्ट efficiently in the last 1 month before the exam
Okay. So basically, to revise all the 19 subjects, we have to give away our obsession of doing perfect revision. There is nothing called as ideal or perfect revision. You have to do multiple imperfect revisions to become perfect.
yes
Okay.
sir
So, how we are going to plan this last month is 30 days. If I take this, first 20 days, we are going to have one program. Next 7 days, that is last week before the exam, we'll do something. And last 3 days before exam, that means 7 plus 3 becomes 10 days. So total 30 days, we are dividing into 20 plus 7 plus 3. All right. So,
yes sir
first of all, I would like to tell everybody whatever schedule you might have made for yourself, most likely that is the best one for you. Okay, last moments pe I don't want people to keep switching their strategies and their plans because somebody else is telling you to do so. तो हम जो भी बात करेंगे whatever I'm going to tell you right now is basically you will follow your own schedule, stick to it. As I already told you, quick revisions karna hai, multiple revisions you have to do. Okay, now when you sit to revise, not everything on the page will be important. तो आपको ये चीज समझ लेनी होगी बिकॉज आई एम होपिंग दैट बाय नाउ यू मस्ट हैव डन सम टेस्ट एंड रिविजन्स. सो आपको एक आइडिया तो आ गया कि मोस्ट लाइकली ऑन दिस टॉपिक दिस इज द थिंग दे विल आस्क ऑन दिस पेज, दिस इज important. Example, let's say you're studying pharmacology. A pharma ka first page of the notes when you open, there will be things written as pharmacokinetics, pharmacodynamics, which I know you as a doctor know the definitions. तो अब उस पे टाइम वेस्ट नहीं करना है. डू नॉट सिट एंड रीड द डेफिनेशन ऑफ काइनेटिक डायनामिक. Instead, skip through those parts which you already know and come to those places जहाँ पे you know that ये drug का नाम मुझे याद नहीं है. I don't remember this name of the drug, so I need to revise this. So that's how, if you quickly keep going through this, then you're going to revise things properly. अब आप example gynecology पढ़ने बैठोगे, maybe you know the menstrual cycle already, so don't waste time again doing the same thing. तो आप ये करने वाले हो, this is what you will do. Basic topics which you already know, don't waste time on this because you have very less time now. This we are not talking about the regular prep, we are talking last month prep. All right. तो ये first चीज हो गई. Now what you should also do this time when you're revising, take a marker, preferably some new color, which you haven't used before, and whatever is important and what you forget, ये दो चीजों को mark कर लेना है. Mark these two things, keep it aside, and this parts we are going to revise in the last 7 days before exam. ठीक है, तो ये सब strategize करके आगे बढ़ेंगे. Now, how
Yes,
do
sir.
you start your day? ठीक है, sleep is very important. Without sleep, if you're doing your hard work, burnout बहुत जल्दी होगा. This is a mistake that a lot of students do. They will think that हम 3 घंटे सो लेंगे and will keep studying like that in the last month. That's not how it works, right? You have been studying for this exam for quite a while now. Trust your subconscious, उसमें कुछ तो होता है. Despite having the feeling कि अभी मुझे कुछ याद नहीं आ रहा, nothing I remember, trust me when I say this, every student who passed this exam will feel the same way, but yet they will pass this exam. तो अभी करना क्या है, as I said, have a good sleep, at least 6 to 7 hours की sleep चाहिए. So let's say I would actually advise you sleep by 12:30 maximum, get up by 6:30, 6:45, 7 o'clock से we will start our day. Now, theory पढ़ना है. 7 o'clock till 8 or 8:30 in the evening, we will be studying only theory. All right. And 2 hours we will assign for MCQ practice at the end of the day. जब हम थके हुए होते हैं, when we are tired, we should be doing the MCQs of that topic. इससे क्या होगा? Whatever you studied in the daytime, now you will develop a pinpoint memory. MCQ एक अलग चीज है, theory is a separate thing. We need to keep a fine balance of this, right? So that's why I'm allotting 2 hours. Imagine you're done by 8, 8:30 today. Half an hour rest le lo, revise, take some rest for half an hour, eat something light as a dinner. Next 9 o'clock start your MCQ again, finish it by 11 o'clock. उसके बाद एक आधा घंटा रेस्ट ले लो, 11:30 12 you should sleep, right? So sleep maintain करेंगे, we'll start our day by 7 o'clock and we'll go for this much time. कितने
Hmm.
MCQ करने हैं roughly? All right. See, again, I wouldn't say 400 MCQ कर लो, that's not practically possible. So quality of MCQ आप जो भी पढ़े हो, if you do 70-80 MCQs also, that covers majority of the portion of a subject. 80 to 90 MCQ is enough. अब वो 80-90 MCQ में what you need to do is obviously 1 minute for one question, so 80 minutes तो 1.5 hour ऐसे निकल जाएगा. Now next half an hour to 1 hour, you will visit the topic which you did wrong. इसका एनालिसिस करना है. A lot of students don't do this. They will just see right हो गया, wrong हो गया, 70% score आ गया, whatever it is. Sir, this is a test you are taking right now. This is not the real exam. This is not your permanent score. So what you need to do, improvise. Whatever you did as a mistake today in this test, revisit that topic from the notes quickly. That 1 hour we should allot and we should sleep. Next, as I said, we
Hmm.
will start our day by 7 o'clock, Dr. Sharmin.
Yes,
And
sir.
I would advise that hard topics should be done in the morning only. जब हम fresh होते हैं ना, when we are fresh, that's the time you should take up something. See, everybody is different. For me, something may be difficult, maybe it's not difficult for you. तो ऐसे जो topics होते हैं, we should do it in the morning itself, preferably after first break. Okay. Now पढ़ेंगे कैसे? 2 hours we are going to study. All right. Whenever we sit to study, let's say you start by 7 o'clock, 7 to 9 we should study. Now in that, I will divide that time of 2 hours into 1 hour 45 minutes. मैं उतना ही पढ़ूंगा. Then whatever I studied in that 1 hour 45 minutes, in the next 15 minutes, I'll just turn the pages, quickly re-revise what I studied. तो एक बहाने से क्या होगा, 2 बार रिव्यू हो जाएगा. बिकॉज ये एग्जाम पास करने के लिए वी नीड टेम्पररी मेमोरी. If you have taken the exam already, Dr. Sharmin, maybe you know this. All right, so this is that exam where you need temporary memory. तभी हम ऐसे पढ़ेंगे. Now, last thing, because this question हम एक पूरा strategy बात कर रहे हैं, that's why I'm not taking any questions of yours, Dr. Sharmin. Let me complete this. उसके बाद में we'll discuss some of the questions. In a day, my strong recommendation is take 2 subjects at least. Okay, because one subjects you get saturated. So क्या करना है, take one major subject and one minor subject. So I'll give you at least 2 blocks जिसमें आप 7 to 8 subjects major complete कर लोगे. Example, if I start studying anatomy, all right, anatomy I should take something relatable to that. जैसे कि एनाट अगर मैं पढ़ रहा हूँ फ्रॉम मॉर्निंग 7 till 3 to 4 in the evening, right, then उसके बाद I'll take orthopedics. So anat ortho will be finished. Now what is one more subject related to anat? It is nothing but your surgery. The next day I will take surgery, roughly a lot, 20 to 25 hours for big subjects like surgery, gynae, medicine, etc. Right? Maybe 4 5 hours plus minus. So 20 to 25 hours allot karenge. That means if you're starting from 7 till 4 to 5, if you're studying one major subject, so you will get roughly 10 hours. मतलब 2 दिन में, in 2 days, 2.5 days, you should be finishing one major subject. Okay, so I hope you understand that. And then remaining time, 6 to 8 hours, you should allot for small subjects. Example, ortho पढ़ रहे हो, forensic पढ़ रहे हो, skin, whatever you're studying, allot 6 to 8 hours. That's quite enough. So in one day, we are taking two subjects, one major, one minor. At the end of the day, at least you will get a good feeling of accomplishment that yes, it was a productive day for me. ठीक है, तो हम कम से कम 2 सब्जेक्ट करेंगे ऐसे. हाउ टू स्टडी इन दैट 2 hours, दैट ऑल्सो आई टोल्ड यू, 1 hour 45 minutes पढ़ेंगे, देन 15 minutes रिविजन विल डू. राइट, सो लाइक दैट, देन टेक 15 minutes 20 minutes break, then restart the cycle once again. Now last week mein what we need to do, last 10 days, last 10 days of the month, again I'm dividing into two. One is 1 week 7 day window and 3 days window. Now, on the 7 days, first 3 days, what you can do is take big subjects, conceptual subjects like OBG, surgery, ENT, opthal, things like that. Next 3 days, matlab nearer to the exam, you should do volatile subjects because they're volatile. Again, कितना ही पढ़ो भूल जाते हैं ना. So that's why you should revise the volatile subjects just before the exam. All right. So कौन आ जाएंगे in the volatile? What are the subjects you should do? Micro, pharma, PSM, biochemistry, etc. Then one day, 6 days ऐसे हो गए. 3 days of OBG surgery, those subjects. 3 days of volatile. Then one day you can revise the profs: psychiatry, radiology, orthopedics, forensic, and skin. ठीक है, एक दिन में 2 hours क्विक रिव्यू करना है. Now this is the time we are not going for the concepts and all. We are just quickly revising the MCQs. That's all we are going to do. All right. And बचे 3 दिन, last 1 or 2 days if it is left, try doing the test and discussion papers of your organization wherever you studied from, or your self studies. You might have taken some subject wise test, right? So take those and you should be good to go. Okay, so that's what my plan for you for the entire month would be. So again, reiterating what I said, 20 days में हम one review कर रहे हैं, 2 subjects a day, one major, one minor. Next, in the 7 days or the last 10 days जो बचते हैं before exam, 7 days we will take up. First 3 days we'll take subjects like OBG, surgery, etc. Last 3 days we'll take volatiles. Now the last 3 days that is left for me, I'm gonna do T&D papers, things like that. And let's say you're too anxious, अब पढ़ाई नहीं जा रहा, तो at least sit back, watch a rapid revision of some important subjects at 2x speed. एक बहाने से some passive information will keep going into your head. All right. So I guess that's the plan for the last month.
Hello, hello, sir.
Yeah,
System disturb, sir.
no issue. So we
Hello,
have already addressed the first question जो आपने पूछा था कि last month का क्या करना है. So I've told everything in detail. So any other question, doctor? आप म्यूट पर हो. आप म्यूट पर हो डॉक्टर.
sir.
हाँ.
Now I'm audible.
Yes, you're audible.
Sir, is it better to study from multiple sources or stick to one resource?
See, इसका आंसर है please, please, please stick to the same source you have studied from. Right? Do not switch anything in the last moment. This is one of the blunders that a lot of people do. That last moment पे what happens is they are hearing from one friend कि भाई इस नोट से आ जाता है, ये नोट से हो जाएगा. So please remember, every faculty is teaching you well. ठीक है. So all of us give you the things which are important only. So if you have studied from one faculty, please study from them only. वही notes पढ़ना है. Do not change any source because you have developed already some muscle memory to that subject, to that notes. अब change करोगे पूरी मेहनत बेकार होगी. Do not do that, please.
Yes, sir. Sir, what is the best strategy to give grand test?
See, if you want to take grand test, first of all, I would like to say that grand test is not a tool to assess your preparation के मुझे कितना आता है. A lot of people do that, and in fact many people don't take grand test or mock test, whatever you want to call it, thinking that if my score comes less, then I will get demotivated and I will not study. Okay,
Yes,
please
sir.
do not do that mistake. देखो भाई, if you want to play in the stadium, first you have to practice in the practice net. फिर जाके स्टेडियम में खेल पाओगे ना. सो जीटी का
Yes, sir.
पर्पस क्या होता है? Why do you need to take a GT? पहले ये समझ लो. GT is the one that gives you time management. ये बड़ी इंपॉर्टेंट चीज है on the day of exam. Time management आएगा because in GT you will see some questions are big, some questions are small. तो अब आपको time divide करना आएगा. You will learn how to utilize the time properly. Not every question will require 1 minute. Some questions may require more than 1 minute. Some questions may require 40 seconds also. So ये time divide करने की आपको ability आएगी. That's why you need to take that GT. Second, it also gives you focus ability to sit for that much time and solve MCQ. Third, random question solve करने की practice होगी. Because a lot of students, wherever they study, self study or some organization, they will keep taking subject wise test. अब आपका दिमाग उतना ही चलेगा. If you are having a test of anatomy, you study anatomy subject, then you take MCQs of anatomy. But that's not how exam is. Exam में तो random MCQ आएंगे. That's why you need to take a GT to get that practice also. Third thing, GT will tell you if there are some topics which are important, you did not study them. वो question आपको आएगा ना. So you will get to know that ये topic important है, faculty ने दिया है GT में, but I did not study that. So now you should sit and study that. Analysis of a GT is very important. Now I'm sure लोगों को question आएगा, सर कितने GT लिखने चाहिए? See, at least 2 to 3 GTs are good for you. But अगर time नहीं मिलता है, तो at least take 1 to 2, that too after finishing 10 subjects. 2 subject पढ़ के आप GT लिखोगे, क्या फायदा होगा? Right? You
Yes,
are just
sir.
going to mark something correct, something wrong. उससे कोई फायदा ही नहीं. So at least 10 subjects when you finish, then take a GT. So that's my take on your grand tests.
Yes, sir. Sir, how to overcome from distraction like social media?
Okay. सबसे पहले the word is social media. You have to be very unsocial now. Be selfish.
Yes,
Turn
sir.
off all this, things like which are not helping you in studies. ठीक है. सेल फोन से दूर रहो. इनफैक्ट आई ऑलवेज एडवाइज कि अगर ऐसा है तो कीप द सेल फोन आउटसाइड द रूम, सिट इन द रूम एंड स्टडी. Right? If the
Yes,
cell phone is near you, you will get distracted. We are all human. If we just open one thing, there is one notification. After that, we keep using that. So that's where cell phone se dur raho. Okay. If you want to use a cell phone, this should be in the evening. Chalo, you're following some faculty page on Telegram, Instagram, you solve some MCQs, that is okay. But apart from that, no cell phone use. ये आपको खुद पे कंट्रोल लाना पड़ेगा. Nobody can tell you to do this.
Yes, sir. Sir, about microbiology and pharmacology, how can we score more? How can we read?
See, microbiology and pharma both comes in volatile subjects. पहले तो ये चीज़ हम मानते हैं. I as a faculty will agree on that. Unless you revise them couple of times, it's not
Yes,
going
sir.
to be easy. But अगर आप पढ़ लेते हो, at least micro I can tell you is going to be very easy in the exam. It's very scoring. ठीक है. माइक्रो क्या है? एक पैटर्न है. माइक्रोबायोलॉजी अंडर अ माइक्रोस्कोप, व्हेन यू सी ये भाई दिस गाय लुक्स लाइक दिस गाय लुक्स लाइक दैट, राइट? सो दैट काइंड ऑफ पैटर्न्स आर देयर. तो वो आप सीख लोगे तो यू विल बी गुड. There is one video of mine, rapid revision की type का ही है, 2-3 hours of a video. See, if you watch that and you start reading your notes, it becomes much more easier to revise. You can do that.
Yes, sir.
Pharmacology. Now, if you want to study pharmacology, what do you need to do? पहला काम, rectify what is the drug of choice for some disease. इतना तो हमें आना चाहिए ना. As a doctor, tomorrow you're going to treat a patient कि भाई this disease is treated with which drug. इतना पहले सीख लो. Once you're done, then rectify some side effects of drugs. Once you're done with that, अब आते हैं लॉजिक पे, मैकेनिज्म ऑफ एक्शन, जो कि कॉन्सेप्ट होता है कि भाई why am I giving this drug in this disease. If you're done with the first and the second step, there itself you'll score at least 60% of pharma questions. Okay. Now remaining 20-30% will come on mechanism of actions, etc. And वो आप last step में करना, because a lot of people get lost in the mechanism part. हम ड्रग ऑफ चॉइस तो रख लेंगे, वो तो मैं रोड चलते बंदे को भी सिखा सकता हूँ, ये बीमारी को ये दवाई देते हैं. सो लाइक दैट यू ऑल्सो हैव टू मेमोराइज साइड इफेक्ट्स एंड ड्रग ऑफ चॉइस, then go for the mechanism. That way, break it into parts and study, you'll be okay. All right, so that's how micro and pharma can be taken care of. And please छोड़ के नहीं जाना है. These are the highest yield topics from part 1 paper. दोनों मिला के कम से कम 40 to 55 questions रहेंगे. Right, 55 is not a joke. It is 1/3 of your passing score.
सर जब भी माइक्रोबायोलॉजी पढ़ते हैं तो फिर सर ऐसा लगता है कि ये फिर से न्यू पढ़ रहे हैं, सारे सब कुछ न्यू होता है.
See, that feeling you will get because देखो, when you were in probably in your second year MBBS, उस टाइम भी हम जितना एग्जाम पास होने उतना ही पढ़ते हैं. We just studied how much ever is required to pass the exam. Selected topics, what were there, we just studied, we forgot it. Okay. Now, if you see, same thing happens here. When you come back from your universities, colleges, now you sit in our classes. आप एक ही बार तो हमारी क्लास सुने हो ना. Once you have studied with me in this class, so now we have a over expectation that एक बार पढ़ लिया तो याद हो जाए. That doesn't happen. So that's what I'm saying. Once or twice when you study, you get familiar with the topic. Third time when you study, now you know many things from the topic. So that's why, as I said, there is that rapid revision type of a video YouTube पे. You can just type my name and there is like 3-hour video. उसको देख लो and साथ में whatever your notes are, you may just revise from that. Okay, so that way you can overcome this problem.
रिवीजन इज इम्पोर्टेंट.
Definitely, definitely. वरना सब जितना पढ़ा है सब बेकार है. Without revision there is nothing. You and I, we are all the same. जितने faculty है, हम भी तो student थे. We always had to revise the same things. Then only we can overcome that. Problem है तो उसका solution है. But the question is, are you willing to work for it without making an excuse? बहाना बनाना बहुत आसान होता है, पर मेहनत करना मुश्किल है. पर अगर आप ये मेहनत करना चाहते हो, तो फिर आराम से कहानी हो जाएगी.
सर हम ड्रग्स का नेम्स हाउ टू रिमेम्बर,
See,
एनी
the
फॉर्मूला.
formula kuch nahi hai. See, the difficulty that many students face, I understand that. Why? Because you're not in practice right now. Just like, अगर मैं आपसे पूछूं right now, what is the drug we use for fever? You would have said paracetamol. क्यों भाई paracetamol क्यों याद है आपको, but why not others? Because you have seen paracetamol for that much time. You have seen that people use it. So like that, once you come into practice, you will know the names of drug. But abhi mushkil kyun hai? As a student, you're not seeing cases every day. You're not prescribing drugs. So अब करना क्या है? Exam तक तो pass होना ही है ना. तो
Yes, sir.
how to do that is, first thing, write down patterns of the drugs. कि भाई calcium channel blockers are dipines. So ACE inhibitors are prils, ARBs are sartan. ये एक छोटी सी लिस्ट बना लेना and stick it somewhere. Keep seeing that every day. So by this, you will know at least 60% of pharmacology because all of them have patterns. ठीक है. So once you know the patterns, इनको जब आप पढ़ने बैठोगे, say that 5 to 7 times. Example, आप पहली बार if you're studying ACE inhibitor, close your eyes, say ACE inhibitor prill, ACE inhibitor prill. Say that at least 5 10 times. याद होगा. Okay.
Yes, sir. Sir, how to practice questions? सर क्वेश्चंस कभी बनते हैं और फिर सेम क्वेश्चन कुछ दिन बाद देखो तो फिर वो सर लगता है कि ये न्यू है, ये नहीं बन सकते, तो सर हाउ टू टैकल दिस?
Question is just like playing a game या कोई sport खेलते हो. Cricketer, let's say a batsman, he has practiced, batting so much time, but still he doesn't know when the ball comes, will he be able to hit it or not. एमसीक्यू भी ठीक उतना ही वैसा ही है कि भाई नॉलेज है डजंट मीन दैट यू विल सॉल्व द एमसीक्यू करेक्टली और यू विल नॉट सॉल्व. इट ऑल डिपेंड्स कि आपको कितना ढंग से याद है. सो एज you do some MCQs, you will start developing a muscle memory of MCQ also. इसीलिए तो एमसीक्यू करना इंपॉर्टेंट है. वंस और ट्वाइस
यस
व्हेन यू
सर.
डू सम एमसीक्यूज यू विल मेमोराइज. एग्जांपल, आप पहली बार जब पढ़े होंगे आउल्स आई इंक्लूजन्स, मे बी यू डिडंट रिमेंबर साइटोमेगैलो वायरस, बट एक से दो बार जब ये क्वेश्चन कहीं दिख जाता है ना, नाउ यू विल नो अरे भाई इसका करा था एंड द आंसर इज दिस. बट इफ आई आस्क यू सीएमबी का अपीयरेंस कैसे होता है, मे बी यू विल नॉट बी एबल टू से. अब ये रेट्रोग्रेड
यस.
मेमोरी बनती है कि आउल्स आई सीएमबी में दिखता है, but if I ask you CMV में क्या दिखता है, maybe you will not be able to say it like that. That's how we learn from MCQ. MCQ is a learning tool, not a judging tool.
ओके सर, थैंक यू सर. और सर मोस्ट कॉमन मिस्टेक एफएमजी एस्पिरेंट्स के लिए सर उसे हम कैसे अवॉइड करें?
See, if we are talking about the mistakes, सबसे पहले, as I said, कि do not just study theory, or do not just do only MCQs. You have to
यस
keep
सर.
a fine balance of both in a day. I'm talking about exam going batches again. So if you're studying from morning 7 till 8 in the evening, as I said, keep that fine balance of studying and stopping till then, and then do 2 3 hours of MCQ. Now, when I say 2 3 hours, I said 1.5 hour for just solving MCQ, and then 1 hour for reviewing the wrong topics. Right? So ये इतना कर लो, तो that should be good. Next mistake that a lot of people do, which we already discussed, switching sources at the last minute. Do not do that.
यस.
Okay? And do not just rely only on the rapid revisions. आपने जो पढ़ा है, the notes that you have studied, that is important. From that, give it a glance. Don't just watch a video of a rapid revision and you're done. No, no. You have to revise from your notes because that memory comes back. Next
यस सर.
is, on the day of exam, do not discuss the answers with anybody after the first paper is over. And do not change your answers. I fold my hands and I tell you that many people, when they change their answers, majority become wrong. So don't change your answer. Once you have clicked something, that's it. All right. And one last thing
यस.
that I'll tell you on the day of exam, the tip, if you see a big question, read the last 2 lines of that question first. It gives you an idea what the question is asking. Is it investigation or is it something? Example, if they ask what is the, you know, recognition pattern, or how do you recognize this on the x-ray or something like that, okay, then you might be looking for some pattern. Now when you're reading the question from first line after that, आपको already idea होगा कि ये investigation पूछ रहा है, so I need to quickly run through that. Your brain will already start, ruling out some things and consolidating some things. So हमेशा big question में last 2 lines should be learned, uh, read first. So that's all. These are like common mistakes. I hope if you avoid them, you should be good to go.
Sir, in last, is it okay to study at night?
No, I see. You might be studying in the night, in your college life, and even after you have joined the classes here, that's okay. But last month may at least you should now try to slowly switch. I know that it's not going to happen if I say just like that. At least half an hour, 1 hour, you have to keep going back, because trust me, the problem that you will face if you are studying in the night, every day your habit will be you'll be studying in the night, and in the early morning at least till 12 or 1 you will be drowsy. That means your brain will not be active, because ye to roz ki aadat hai. Now, what happens on the day of exam? Exam is in the morning, 9 o'clock, or whatever the time you will be going there. So you have to be mentally awake on that day. तो इसीलिए we should align ourselves, in fact, you know according to the time of exam, so that that day we should be okay. I know many examples of students who are good students, they study in the night, but दिन में exam के time पे they were sleepy, they were not able to focus as much, and that leads to silly mistakes. जो ये होता है ना कि जानते हुए क्वेश्चन रॉन्ग होता है, आई न्यू दिस टॉपिक येट आई मार्क्ड इट रॉन्ग, दैट्स बिकॉज ऑफ योर ब्रेन नॉट बीइंग फुली एक्टिव. That's why please slowly change the habit and start sleeping by 12:30 maximum.
Okay, thank you, sir. Sir, what are your top tips to stay motivated during low or hopeless phases of preparation?
Okay. Um, on this, I may beg to differ maybe from other people, but to me, motivation is a myth. Okay, life is something that is not always sweet to us. Sometimes we need to swallow bitter medicines and do the things. See, you will never be always motivated, so force yourself to be disciplined. Discipline है तो पास हो जाओगे. Because
Yes,
some days you say, when I'm only motivated I will study. Unfortunately, it doesn't work like that. Okay, so as I said, medicine, if you're taking, it will not be tasty, but you need to take it to get better. ठीक है, दवाई कड़वी होती है पर लेना पड़ता है. सेम थिंग, एग्जाम इज देयर. यू हैव टू टेल योर सेल्फ दैट nobody is doing this for me. आई नीड टू फाइट माई ओन बैटल. खुजली होती है तो खुद को खुजाना पड़ता है, कोई आके नहीं खुजाएगा. सो अब फीलिंग्स होंगी, आई एम फीलिंग बोर्ड, आई एम नॉट in a mood to study, that you have to keep aside, keep the book in front of you and start doing something. अगर बिल्कुल ही मूड नहीं बन रहा, solve some MCQs at least. As I said, MCQ is like a game. At least your brain will get some interest once you study. Solve some MCQs, do the retrograde study. This I am saying on a day जब बिल्कुल ही पढ़ने का मन नहीं है, that day solve some MCQ. If you did it wrong, open that topic and read that. आप एक MCQ किए PCOS पे, गलत हो गया, come to PCOS topic and study that. All right, so that's what I will tell you, because trust me, if you are not willing to work enough for it, then do not complain of not having it. ये हक फिर हमसे छिन जाता है जब हम मेहनत नहीं करेंगे, तो फिर आपको कुछ ना मिलता है तो फिर उस पे हमें गम मनाने का भी हक नहीं है. सो दिस इज व्हाट आई विल टेल यू. डू नॉट सी, मोटिवेशन कई बार क्यों चला जाता है पता है? दैट मेनी ऑफ अस स्टार्ट कंपेयरिंग आवरसेल्व्स टू other people's preparation. Now I lose my motivation. Are yaar, that guy is studying this much, I am studying this much. We are all individuals. आपने जो पढ़ा है, who knows? Did you take the exam yet? नहीं ना. Maybe you know enough to pass. And in fact, most of us know enough to pass. It's just the anxiety that we create for ourselves by thinking ke or. Whatever your faculties have taught you, please know that much and you should be good. नहीं तो क्या होगा कि unnecessarily, as I told you, that if you keep comparing to yourself, 3-4 days you do too much of studies, you will get exhausted, burnout, and then फिर पढ़ने का मन ही नहीं करता. You will have this kind of phases, ups and downs. That's why consistency, as I said, discipline, रोज पढ़ना है थोड़ा थोड़ा जितना बोला गया है, that's what you will do. And my
yes.
friends, on the day of exam, you are the winner until the last question. जब तक 300 क्वेश्चन खत्म ना हो जाए, you have pass this exam. ठीक है, don't give up on first few questions. Imagine your luck is bad. ठीक है, आप सब जानते हो, I don't know if you know this, if you're a newcomer, out of 300 questions, at least 50 to 60 questions will be those that I do not know anything about. उनको सिर्फ क्लिक करना है and move on. That's all you need to do. Do not waste your time on those questions that you don't know at all. So I am saying, imagine from those 50 questions, five questions came in one line for you. First, second, third, fourth, fifth. पांच के पांच नहीं आते. Now what happens? Your mood goes down suddenly. You're like, अरे यार पूरा पेपर खराब हो रहा है. Please trust me. If five questions goes down for you, then next five will take you up. So that's why do not give up until the last question. Have faith in your preparation. Believe in yourself and believe in God. You will be rewarded soon. Okay, so please do not have any regrets of under preparation. Whatever happens will happen on the day of exam. देखा जाएगा.
Okay, thank you, sir. So thank you for your guidance, help.
It was my pleasure. I hope this few minutes that we have spent together can help at least few people. And best wishes for your upcoming exam and all the people who might be watching it later also for your exam also best wishes. Thank you so much for having me, Dr. Shani. It was
Thank you so
great.
much, sir. Thank you, sir.
Thank you. Thank you so much.